Swadikap, good afternoon once again. Just now we had the Thai language briefing by Dr. Apisamai, followed by a briefing by the Director General of the Communicable Disease Control Department or CDC, Dr. Opat. So I'll just recap those two briefings for you with additional information that may be of interest to the English language audience. So firstly, with the new confirmed case and new recoveries, the numbers that we have for today, the Friday, the 4th of June, 2021, we have new recoveries at 2,493 persons, almost 2,500 persons recorded as recovered for today. We have new confirmed case, as you see on screen, 2,631 cases. So the number of new recoveries and new confirmed cases are actually close. For the new confirmed case, 2631, out of this number, we have 2,580 cases, which are cases from local transmission. And we have 1,306 cases reported from within the healthcare facilities, 1,085 cases from active case finding missions, 189 cases from within the prisons and penitentiaries, and 51 from international arrivals who are in the state quarantine system. So that was the breakdown of 2,631 cases, new confirmed case that we found recorded for today. For new fatalities, unfortunately, we have recorded 31 new fatalities, making the cumulative 1,177. We have, however, some information that most of the fatalities are in Bangkok, as in the past few days, 20 fatalities, followed by Samut Prakan, Chiang Mai, and other provinces. Majority cases for those having diabetes, high cholesterol, high blood pressure as the underlying health conditions of those who succumbed. And most of the fatalities are from those who had contracted the virus from family members, colleagues and friends, and from high-risk areas. The age range today is 17 to 97, with the median age at 68 years old. So just some additional information, observations from the Thai language briefing. Most cases are still detected in the high-risk marketplaces, the factories, and the accommodation for factory workers, crowded communities. So the daily CCSA meeting this morning actually reviewed these clusters detected in such locations in a total of eight provinces, which include Pathum Thani, Samut Prakan, Chonburi, Saratburi, Phetchaburi, Tak, Ranong, and Trang province. In Trang province in particular, 526 cases were detected at a glove manufacturing factory, with risk factors identified from dining together and using shared facilities. Health authorities also discussed findings from a cluster found in a factory in Samut Prakan province, whereby risk factors came from sharing utensils, sharing of facilities, recreational activities after work, and visiting marketplaces, which had previously been reported with cases of COVID. Now, if you recall, in the past few days, we talked about the good factory practices, which the CCSA authorities are stressing and enforcing with various factories. In the meeting this morning, we emphasized that again about the implementation of GFP, good factory practices, so that the various companies and factories can continue to perform their business activities under these safe conditions. And in the meantime, also active case findings also continue in the various factories. In addition, cases are still being detected from people who enter the country via the overland border checkpoints and entering illegally through natural border crossings, natural pathways. So the CCSA has consistently emphasized that people should enter the country via the designated legal border checkpoints and enter into the state quarantine system for their own safety and for public health safety. In Bangkok, the majority cases are still concentrated in the majority of cases are still concentrated in Bangkok and the periphery. If you see the map of Thailand now on screen, you will see that most of the provinces have reported 10 or less than 10 cases today. So you see the visuals there, the graphic there. You see more green and white than you see orange and red. So that's a good sign. And the 24 provinces in white, you see there, are meaning it means the ones that are reported of having 0 cases, no cases. And there are 35 provinces in green. So green means reporting 1 to 10 cases only for today. Now, for Bangkok, 57 clusters in 32 districts reported today, with the Thai language briefing focusing on clusters in Bang Kapi district as well as Sapan Hua Chang district. Where in Sapan Hua Chang district we had testing in the active case finding mission testing of up to 882 persons. As well, and the focus on clusters was also in various other communities aside from Bang Kapi and Sapan Hua Chang district, other communities and districts such as Ratchathewi. So the CCSA is consistently evaluating to improve the hospital referral system, to ensure sufficient supply of hospital beds and can ensure that confirmed cases can be transferred to hospitals as soon as possible. So we have some photos there up for you on screen on the hospital referral system. This one in particular is from the Bang Khae district in Bangkok. This morning also, AstraZeneca delivered the first batch of vaccines to the Ministry of Public Health, who would distribute them to every province within this week. This is the one produced in Thailand, and in preparation for the mass vaccination, which will start on the 7th of June. So according to the Deputy Director General of the CDC, 2 million doses of AstraZeneca and Sinovac have already been delivered to all provinces in this first week of June in proportion to the infection rate in each area. Now, just to explain a little bit further, which was touched upon by Dr. Apisamai, that the distribution of vaccines across the country had been adjusted slightly in terms of supplying the vaccine supply needs in the provinces to a weekly basis instead of a monthly basis. The reason is because, as you would all understand and know, the situation is very fluid and it changes every day, it changes every week. So the adjustment for the sending off of vaccine supplies will be weekly now, and the Director General of the CDC had explained further just now about this. The meeting this morning of the CCSA also had a video conference with the provincial governors around the country as well. So in order to synchronize and understand the adjustment in the sending of vaccine supplies on a weekly basis. So the evaluation would be on a weekly basis. If any province would be needing more vaccines because of a high number of cases, then that will be adjusted accordingly on a weekly basis, which would be timely enough. Now, the vaccines would be available to all provinces and have already been sent to many provinces already. Actually yesterday and today and this past week, to prepare for the mass vaccination in June. So Dr. Opat, the Director General of the CDC, gave a briefing just now. And he touched on a couple of issues, including, as I mentioned, the managing of the demand for vaccine supplies in each province. And they'll be doing that in accordance with the actual situation on a weekly basis and filling up that supply as needed. The vaccination centers and vaccination centers and hospitals or venues around the country actually have a very high capacity in terms of the inoculation. That's something that's already standing. So as soon as they receive the supplies, they will be able to inoculate people at the highest number and capacity. In terms of the vaccine, he mentioned that at the end of May, there were already 3.6 million doses already inoculated, and that was end of May. Now, the past week had seen that number increase to almost 3.9 million, and soon it will be 4 million. So 4 million doses being administered already. The total number of vaccine supply that we're receiving, it would be up to 100 million doses. But of course, we have to understand that the plan would be fluid, as this is still vaccination for emergency use. Now, within the month of June, there will be a total of 6 million more vaccine doses arriving. So therefore, if you do the math, approximately 4 million have already been vaccinated, 4 million doses, and we'll have 6 million more doses. So there will be a total of 10 million doses already vaccinated by the end of June, because the vaccination capacity is high. So 4 already, 6 coming. So within the end of June, we'll have already 10 million doses of vaccines already vaccinated into patients. So just additional information on vaccination for the foreign nationals, particularly in major cities such as Chiang Mai and Phuket. So firstly, yesterday, Chiang Mai launched a website for the registration for foreign nationals in that province. Those who have not registered via the MAPROM application can now register for vaccination via the Kampang Wieng, or the Wall of Chiang Mai website. And you have that website link on screen for you, Wall of Chiang Mai website, wallofcm.chiangmaihealth.go.th, and they can enter their passport numbers to register. For people whose organizations already have sent their name for vaccination, or those who registered already via the MAPROM app or through their hospital, through the local hospital wherein they have the medical record, there is no need to register via this website again to avoid duplication. And this is for foreign nationals resident in Chiang Mai. As you recall, as I mentioned, particular provinces will have their structure and plans in order to register and vaccinate foreign nationals, aside from the designated hospitals, aside from the various schemes that I had mentioned earlier. Each province would have their own as well. So this is one case in point, one example of that. Now in Phuket, officials are preparing for the planned opening of the province next month, the 1st of June. The Phuket Sandbox, that you may have heard, which will depend on the situation in Thailand and overseas, as well as approval from the CCSA for the opening of Phuket to tourists on the 1st of June. Nevertheless, Phuket province has started vaccinating foreign nationals on the island yesterday at Central Floresta Mall, and we have some images of that for you on screen right now. Thailand will receive more vaccines this month, as I mentioned, which will be distributed to vaccination centers nationwide for nationals who would like to register for the vaccination. Are recommended to register at the hospital with their medical history, or at designated hospitals as we had mentioned, or in terms of the major cities around the country, as I have mentioned just now, Chiang Mai and Phuket, they have their own platforms for foreign nationals with the ability to key in the passport number for foreign nationals. And of course, when the vaccines have arrived and been allocated across the country throughout this month of June, the vaccination process will speed up, and will seek to inoculate 70% of the population as soon as possible within this year. Now, just a side note that in Phuket, we had some images just now. In Phuket, Actually, around 50% of the entire population of Phuket had already been vaccinated through this scheme already. So that's in preparation of the opening up of the island on the 1st of June, particularly for foreign tourists, according to their scheme. So this is basically the information I have for you for today. I hope it was useful. And over the weekend, we'll have more information for you as we're moving close to the mass vaccination, nationwide mass vaccination program, which will start on the 1st of June. Just mind you that the 1st of June is actually just the first day. It's just the first day that we're commencing this national agenda. So there would be, of course, perhaps appointments or some other management details which will be announced come the 7th of June or a little bit after that. But rest assured that in the months ahead, after June, we'll be moving forward very strongly to achieve our goals of vaccinating most of the people in our country, Thai nationals and foreign nationals alike, to actually achieve something that we really, really hope for, and that we will not be having to face with the COVID pandemic in the level and degree that we have been facing in the past months and in the past year. So thank you very much for your attention. สวัสดีครับ